There's always been an innovation economy, and JPMorgan has an entire business dedicated to helping it thrive. By bringing together founders, startups, investors, and ideas, JPMorgan's commercial bank helps empower thousands of high-growth companies that are shaping the present and the future. With tailored banking solutions and a global business network, JPMorgan helps innovators scale for today and tomorrow. Visit jpmorgan.com/startups to find out how they can help you build your future. Products and services of JPMorgan Chase & Company and its affiliates are subject to availability, eligibility, and applicable terms and policies. JPMorgan Chase Bank, N.A., member FDIC.
Hey everybody, this is TechCrunch Live, where we help founders build better venture-backed businesses. I'm Brian Heater, TechCrunch's hardware editor, filling in for Matt Burns, who is out this week camping once again. I am very excited to introduce today's two panelists. Swathy Prithivi is the co-founder and chief operating officer of the weight loss startup Found. She previously worked as a senior general manager at Opendoor and in operations and launch at Uber. Before joining Atomic VC as a principal, Jordan Kong helped incubate and launch the consumer payments platform Eco and worked for Polychain Capital. They both have some very fantastic stories that I'm excited to dig into over the next hour or so. Also, during today's event, we're going to be discussing some of the trials and tribulations of launching a health-focused startup. You can register now on Grip if you haven't already. It will make it much easier to register for and attend future TCL and TechCrunch events. You can also use the platform to ask questions of our panelists at any time during the conversation. We are also still streaming on Twitter, Facebook, and YouTube as well. The link is on techcrunch.com and should be in all of the other platforms too. And we made it much easier for the pitch practice. Just fill out the form published on Grip and you'll be added to the list. Somebody will contact you if you're selected. Okay, that is it for the preamble. Thanks so much for tuning in, everyone. And let's welcome Swathy and Jordan on now. Thank you so much for joining us today.
Thank you for having us.
Very excited, Brian. Thank you for having us.
Awesome. I am excited as well. Swathy, I want to start with you. As I noted at the preamble at the top, your two big name startups, I guess startups is probably not even the proper term at this point, two big name companies prior to co-founding Found. Why did you take the leap and co-found your own startup?
Yeah, as you mentioned, my career before that is building and scaling what are very operationally complex businesses, marketplaces with Uber and Uber Eats, and then real estate with Opendoor. Really, when I thought about opportunities in the space, I think I really wanted to take some of the learnings that I've gotten from Uber and Opendoor and apply it much earlier stage. I joined Uber sort of in the first 100 folks and Opendoor in the first 300, and I really wanted to go earlier and see how can I take all these learnings and build something from the scratch, from scratch. And Atomic's model, which I know Jordan will tell you about, is really unique. It's sort of pre-idea, pre-sector, and they really just work with individuals to build great companies. And so I was very excited to really think through interesting sectors and build with an amazing team around me.
This is going to make my job much easier if you could keep introducing my next questions like that. Jordan, I wanted to actually get to that up top because, as Swathy was alluding to, Atomic's model is, I would say, at least different than most VCs out there. How does your firm differ in its approach to early stage companies?
Yeah. I think so we are a venture studio, and some of you might have heard that term. And the studio is really like the earliest stages, I think, that you can really be involved in the company creation. So as VCs, obviously, you start interacting with companies at different life cycles, right? So I used to actually work at a firm called Institutional Venture Partners. We were much more in the kind of the later stage growth phase. And it was cool to see there, like, what companies kind of become when they grow up. And here I get to see, what companies look like and have an active role in very much their pure infancy. So how we operate is we're structured as a venture fund. We have a $260 million fund. The difference is the fund exclusively goes to back the ideas and companies that we co-found with founders in residence. So we're very much in that early, we're involved in the ideation phase as well. Founders rarely come, we don't really kind of take pitches from founders on like ideas that they want us to back. And in meeting kind of Swathy, it was exactly that. Like, I think a lot of VCs kind of talk about how, they're very founder first, or they're really like evaluating the founder more so than the idea. And for us, there's only the founder to really evaluate. So we really live by that, and kind of figuring out, is this somebody that we feel like is going to, drive an outsized impact at an early stage? Is this somebody that we feel like we would be well equipped to also support and co-found a company with? And it's, the early conversations I feel with Swathy were very similar to almost like co-founder dating. We were getting to know each other, trying to kind of see where we complement each other and where our strengths and weaknesses are. And then lastly, what's that almost like operating interface between a VC and the founder, or between us as co-founders, how we would operate with each other.
So Swathy, on your end, what was it specifically about the atomic model that appealed to you?
Yeah, I think building on sort of what I talked about earlier, I think coming from logistics, ride sharing, real estate, I think what was most interesting to me is staying in operationally gnarly businesses. And so what I was really thinking about was healthcare as a whole, and really connected with, there's a co-founder at Opendoor who was at Atomic, and sort of, connected with him when I was thinking about how to go earlier stage and what to do. And it was just, the atomic model was very fascinating. I didn't have, one specific idea in healthcare where I'm like, this is it, this is what I want to do. But it was really helpful to, have something like Hims and Hers come out of Atomic, right? So clearly they understand how to build in this space, and a really bright team, including Jordan and all the supporting infrastructure to really help, take it from, I may have a few ideas, to here's a company that's sort of thriving and growing. And so for me, it was a combination of sector, it was a combination of expertise, and just all the infrastructure. I think so much of it was taking away anything that could distract from actually just really testing, iterating, getting to product market fit, and then scaling. So much of the atomic model is how do you help the founder with a lot of that, so they can focus purely on growing the business.
What is? Oh, sorry. I just wanted to know what operationally gnarly means.
I was going to comment on that too. I was like, Swathy, the way we know you are such a unique founder is that you are saying that you want the operational gnarliness. Like, most founders are like, please, I just want, I want to move pixels around and generate cash at the other end. But you're like, no, bring the gnarliness. Is
that like you effectively saying, like, what is the most difficult thing I could launch?
Yes, unsexy, I guess. Yeah. Okay. And when you look at, right, it's going back to, I think, marketplace operations, right? Local, lots of sort of local tough operations. Same thing with real estate. And so, when I looked at sort of areas I wanted to go into, I was like, healthcare looks tougher than all of them combined. That sounds like fun. How do we go building that?
I mean, how much of that is that like just a personality thing? I mean, what is it specifically that appeals to you in doing something so difficult?
Yeah. That's a good question. I think, I don't know. It's just, it's something that isn't unsexy, something that is really difficult. And I think really difficult, ambitious things draws such incredibly passionate, smart people. So I think it's a combination of going at something that's really difficult, that hasn't been done before, building something and seeing it go from an idea to fruition, and then getting to work with incredible people while doing that. And the combination of those three sound like what I want to spend the rest of my life doing. And so I don't know if that answers the question, but.
Yeah, it does. I mean, and Jordan, when somebody comes to you and says the words operationally gnarly, like, Does that appeal to you as well, knowing that this is going to be a difficult problem to solve?
Yeah, so it's interesting as I'm reflecting on this, operational gnarly is like a proxy a lot of times for things that, may have more opportunity than founders kind of get credit for, just because, a lot of people get turned off by that, and naturally so, right? Like it's like a difficult space to operate in. And so kind of we always think of that as maybe that's an opportunity then for us. Secondly, I do think there's a correlation between that and what's like truly driving impact for the end user. A lot of the regulatory, like gnarly or operational and gnarly things are difficult because there are so many moving pieces. Maybe there are more things at stake. Like if you think about, transportation, people can get hurt, or things, or healthcare for sure. It's like literally, lives at stake. And so we think of that as sometimes a proxy just for like impact for the end user. And then I really want to highlight what Swathy said, which is interesting, is like, it really, it really like highlights who's there for the mission of it. Because to your point, no one's here for the sexiness of it, right? No one's here just because it's like a shiny badge to wear. Most people, it's kind of a litmus test for like, hey, are you a true missionary here? And we always love kind of founders who are, in it for a reason bigger than themselves.
Yeah, I primarily write about robots. Like that's one of my main beats over here,
so cool.
and the majority of the the companies that I write about for obvious reasons are, it's engineers, right? It's people who have this like scientific or technical background in building robots. Jordan, I'm curious from your standpoint. Obviously, you're bringing somebody like Swathy on, that she's going to do this great job operationally, but what role does Atomic play in connecting someone like her to, in the case of Found, if it's like a weight loss or health expert, like, do you play a part in finding the other co-founders?
Yeah, I think, when you mentioned robots, I think one of the analogy we like to use internally is that we want to be the Iron Man suit for founders. Like Tony Stark is already so smart, so handsome, but he still needs his Iron Man suit. And so we kind of try to figure out ways where, one, we have enough infrastructure that we can be bespoke to a founder. And so in Swathy's case, it's like, so there's kind of two ways that I feel like we've worked with her. Obviously, Swathy, jump in. Mm-hmm. One is there's a little story we'll tell later where Swathy actually, when she initially joined and partnered up with us, the initial idea that we were working on wasn't Found and wasn't weight loss. And so I'll have Swathy kind of touch on that a little bit later. So I would say that part of our model is really being that partner in the ideation phase too with the founder, and kind of seeing the pattern, having the expertise that an investor would bring to the table, meaning pattern matching, understanding business models, understanding how this is going to scale, and bringing that up to the very front of the company creation phase, so that founders get visibility into that before they commit a year, 2 year, 5 years of their life trying to build something that may not pan out. So really kind of, giving that additional lens, serial entrepreneur lens or serial investor lens early on to the founder is one area we do it. And then the second kind of, going back to this Iron Man suit analogy is, Swathy may be amazing, is amazing at operations. And in fact, like I'd like to say that, if she can't solve it, this is like a problem that can't be solved. Like that's how much confidence we had after working with her for a couple of months. And but I think like when you think about a whole founding team, she might need the right product partner to get something out the door. She might need the right marketing or brand person to really, wrap this up in a way that really speaks to consumers. And so we kind of try to figure out like what's the team we can assemble around Swathy to help all of them, excel and accomplish the vision.
Yeah, I mean, Jordan, you touched on something there that I really did want to talk about. When, in the grand scheme of operational gnarliness, like you're going to try some stuff and it's not going to work out early on. And you've got like a very clear case of that. And I think that this is a really valuable thing to impart on people. When is it clear that it's time to cut your losses?
Yeah, maybe I was actually going to jump in and give some context. So as Jordan mentioned, I didn't join Atomic specifically for Found. It, didn't really wasn't there. So I really started at Atomic because, I wanted to think about healthcare. And for me, the trends that were really interesting was it felt like 1.0 in telehealth was very point solutions and episodic care. And, sort of the 2.0, if you will, felt like the ability to use technology to address chronic conditions. So the first startup or idea that we actually worked on was around allergies. So allergies are definitely a chronic condition. There's a clear financial and emotional burden. There's underwhelming treatment options. And this was really, how do you take what you might get in an allergy shot and make it drops and make it accessible and convenient? So there was a lot of not just identifying the space, but lots of testing and experimentation and meaning like throwing something at the wall multiple times a day, right? To really test, what does product look like? What does pricing look like? What does messaging look like? And so it's so interesting that you're saying, great ideas aren't always great businesses. And that's, I think, something that was so clear to me, sort of, working with Atomic and going through this journey with something like allergies, for instance, right? Investors say all the time, your total available market, your TAM, and it was such a visceral, sort of articulation of it. Allergies, for instance, are the total available market is about 15 billion in comparison to something like weight and weight care, which is 70 billion, right? That shows up in all sorts of ways. And it shows up in customer acquisition cost. It shows up in price, elasticity. It shows up in messaging, branding, and it shows up in just a whole variety of ways. And really, it's so, if you're talking about whether you have product market fit, you probably don't, right? And product market fit it hits you like a mallet over the head, right? There were some interesting, funny tweets that I was seeing, which is like, when you're product market fit because you have no time to tweet because you're just exhausted, right? It's things are growing and breaking, and you're just really like fixing them. And so when you don't have it, you kind of know. Do you actually emotionally recognize it and then act on it? Is the part that I think something like Atomic's model is really helpful to kill your darlings.
I think, Brian, just to kind of elaborate on that, to your point, your question of like, when do you call the shots, right? Like, when do you call it?
Yeah, like sunk cost fallacy. It, at least, the feeling behind it is very real at very least, right?
Yes,
totally. And not just that. I think like part of the mark of a strong founder is their ability to, persevere in the face of obstacles. So in many ways, your founder instinct is like, never give up, never give up. We got to keep going, right? And we talk about this a lot internally, which is, what is like kind of that foil or the devil's advocate or the counterpart, like intellectual discussion you could have against something like that. And so we want to welcome that spirit, because that's the founding spirit that's necessary to take something from 0 to 1. But at the same time, having a relationship where we can sit back and be intellectually honest to be like, well, let's push back on that a little bit, right? And like playing, maybe even taking turns playing that role. Like I feel like Swathy and I did a lot of those back and forth conversations, because it's never, to your point, it's never really clear. When you're working in the early stages, data is always gray. It's never black, it's never white, right? And so we kind of looked at it for, at least several weeks and kind of took turns playing roles of like, no, we should keep going because of this, or like, no, we shouldn't keep going because like this is glaringly clear. So having that kind of partnership is really helpful, in addition to me being able to bring the perspective of, well, with our other portfolio companies at this stage, this is what we were seeing. And this is how I can like kind of guide maybe like the lens, versus founders who are, generally in this stage kind of solo, are kind of in some ways have some tunnel vision where they can only see the data in front of them and can't look across like a portfolio of, other similar type of companies.
I'm guessing a piece of that conversation is scope too, because, Swathy, you say the total addressable market is 17 billion. That sounds like a large number to me, obviously. And like, I have allergies. Everybody I know has allergies. So at a certain point in the process, like, you have to figure out where you're going from here. And is there a place for like mid or small size startups?
Absolutely. Right. And I think it's also a matter of the startup for the model, right? And so much of the venture studio model and sort of a high growth venture backed company is one type of company, sort of in a corporate landscape, right? And so this is really a discussion around. Of course, there's space for mid to small companies or whatever the categorization, but this is really saying for this sort of venture backed high growth company, if you're already sort of hitting a TAM of 15 billion, then there's only so much that you can even play with, and the product offerings that you can test and iterate on are severely limited, right? And so, and so I think it's more of a recognition of the type of company and the type of startup, and their fit for the model.
Great. Yeah. So I mean, one of the really nice things about doing the show is that most of the people who tune in are in fact startup founders themselves. We have a good question from Cecile. The audience wants to know. She says, finding a great co-founder / CTO is very challenging. Any ideas for finding a good CTO?
Yes, they are they are unicorns. So if you chance upon them, don't let them go. But that's not the helpful feedback. I think what has been interesting is I think it's easy to assume that you need a huge, large technical build before you can even go out and test if this is, one, a product that consumers want, and two, are they willing to pay for it, and what should it look like? And so in many ways, I think sort of the atomic model in building was, hey, let's just go try some things, right? Put up landing pages, put up, sort of ads and sort of test it. And so that doesn't directly answer the question, but I think I've been surprised through this journey how much you can get done without necessarily having a, sort of chief technical person in seat. And right, because you're testing and really understanding if there's a product there. And once there's a really compelling product offering that consumers are clamoring for, which, coming back to the journey of, we didn't see it with allergies, but with Found and Wait Care, it was absolutely there. It's then easy to go and even easier to go in and recruit technical talent, because they're not just building something technically complex for the sake of building it, but it's like, hey, there is a real market out there that is ready to eat this product up as soon as it's live. And so one thing has been how low tech solutions and no code solutions can get you a lot of the way there, and getting the traction and demand can then make it more attractive for technical talent to come on board. The last point I'll make is I've also been very pleasantly surprised on how there's a lot of patchwork, particularly post pandemic, freelance consulting sort of agencies who you can work with until you do actually get a a more formal technical partner in place. But all those are options to make sure, one, there is actually 0 to 1. There is actually a product that people care about and are willing to pay for and use. And then after that, right, scaling becomes a far easier challenge compared to figuring out something afresh.
Yeah, I mean, I think unfortunately, I don't think I have a good answer for this either, other than the fact that, we recognize that as a challenge for founders at Atomic. And the way we kind of solve for that is to Swathy's point about infrastructure, we have an internal team of about 60 functional experts. And of those, I think we have a small team of engineers and designers who basically are kind of, it's kind of like a SWAT team that will go in and help a founder get their first product together. But even internally, even though we have those resources to deploy, we actually work with founders and counsel them to delay that. Like the first instinct, Swathy, shouldn't be like, hey, I have this idea for this, like, let's go build something. We actually encourage them to, okay, what can we do without involving the engineering team for the week to get data without a build? So we always think that that's like a more efficient way to get to the right answer.
I'm laughing because you're saying, sorry, I was just going to say, she's saying week. I was like months, right? Like months you can get by with, right? Here is this, how do we deliver something scrappy? And like, you fake it till you make it. And then once there is enough demand, you can actually build a really seamless, sort of scalable kind of solution that doesn't require humans to deliver every part of the experience.
Yeah, I know that. I mean, that was exactly my question was the timeline. When you talk about delaying something like this, like I assume that at very least by the time you're actually out there looking for like real seed funding, you want all your co-founders in place for the most part. Is that safe to say?
It is, but I think it's one of those things where it's like every startup is so bespoke in its own way that I don't think it's a hard and fast rule. I think it really the trade-off is really demand, because if there is demand out the door for this product with the minimal amount of technical infrastructure, I think that's a sign, right? That's a sign that this is a really compelling product. And then now imagine what happens if you add tech talent to it. So I think it's a depends. Like most startup advice, unfortunately.
I would say also that maybe at Atomic, we're unique in the sense that we kind of think about team in a way where we're an active participant in that, right? Meaning like some VCs may look at a team and be like, okay, well, this is the cast and crew. Like, let's evaluate if we think that this cast and crew can execute on this vision. But whereas because we're so involved, we can say, okay, here's the cast and crew today. What does it need to look like 2 years from now? And how do we actually help shape that team along the way? And Brian, to your point, like I think having a fully built, a more wholesome team is certainly more desirable for investors, just because it helps de-risk, the idea to a certain extent. And so that's definitely something we prioritize in helping our founders too.
Well, one of the nice things about the roles that you and Atomic played is I get the sense that you have also played a somewhat active role in actually helping Found with its pitches and the pitch deck and things like that. And we unfortunately don't have one in front of us today, but this is all still pretty fresh. You launched, you raised 2 big rounds within I think about 6 months of each other last year. So if you can kind of walk us through the things that you were really sort of trying to get down on paper, especially around differentiation. When we talk about weight loss, sure, it's a huge addressable market, but there's a lot of people trying to address it.
Yeah, absolutely. I think a couple of things. So I think the first, and happy to walk through some of them. I think the first question that folks have is, what is it and why now? Right. And so when you look at Found is a telehealth company that provides a holistic weight care solution, right, that gives personalized treatment. So we bring everything you might need, addressing both biology and lifestyle. So that means a clinician, that means a coach, that means an app, that means a community. And so when you look at the problem, obesity is the #1 cause of preventable death in this country. Nearly, 50% of the population is obese, and it's over 70% if you look at people who are overweight. And it's very small success rate, despite, as you mentioned, huge crowded industry. Over 50% of the US diets every year, but there's less than 5% actually have any kind of success. And so this is saying, well, so many people are trying, this is so overcrowded. What's really at play here? And I think a lot of this is because obesity is a disease, not a decision, but it gets treated as a decision. And really, this is a shift in treating it like the chronic disease that it is. And so one of the money charts in the sort of in the Series A deck was there's a massive opportunity to talk about clinically safe, effective medications that really help with this, right? And there's a variety of reasons why that's not why they're not prescribed: stigma, right? Availability, knowledge. But there's a chart that basically says what percentage of the U.S. population can actually take some of these medications very safely, efficaciously, and what percentage are actually prescribed for something like high blood pressure. 30% of the population has high blood pressure, almost 20% take it. 10% has diabetes, nearly 8% take medications. But when you look at obesity, 72% of the population can take the medication, and less than 2% of people actually take it. And so that was very much our why now of these are really safe, efficacious medications. There's a whole host of very interesting medications that have come out even in the past couple of years that show higher efficacy. And so what we were saying is this feels like a moment to bring all of these things to the table, including very efficacious medications, and apply it to probably the sort of the biggest health challenge facing our country and probably globally. Obesity is upstream of diabetes, hypertension, stroke, fatty liver disease. There's so many clinical depression. And so this was really an opportunity to say, this is why now. Really what we can do is sort of think about telehealth 2.0, where we apply technology to chronic conditions to make this more accessible, to make this more affordable and far more effective than it's been in the past.
I want to get Jordan's feedback on that too, but before we do, like really quickly, so what are the bullet points there? If you can kind of distill 3 or 4 or 5 things that you absolutely want in that pitch deck.
Yeah, I would say the first is explain the problem, explain your thesis, explain why now, explain how you're uniquely addressed to handle it, and why is your team the set of people that are meant to address it, right? And then really sort of what your vision for that product is. Right. I think particularly in the early stages, I think as Jordan mentioned, it's really a bet on the founder, the founding team, and the problem. And there's sort of a connection between not just product market fit, but founding team market fit, right? Why is this the team meant to solve this problem? And so really the investors are looking for, is this a thesis I believe in? Is this the team that's going to meant to go solve it? And is their approach to it really interesting? And even if it's not, the team will ultimately figure that solution out. So it's really sort of 1 and 2 of large enough problem. Why now? Do I believe the thesis and the team? But Jordan, I'd love your take and feedback.
Yeah, I mean, I think all of those points are right and kind of are things that we're looking for as we're building our own thesis, right? So again, there's a slight difference where we're not taking pitches from other folks. We're in a way kind of doing our own diligence to figure out, hey, is this an idea or a company that we want to continue doubling down on? I'd say like a kind of a, Swathy's favorite word is pithy. She's a writer actually as well, but she's always like, okay, what's like the most pithy way I can say this? And you kind of want to make the convincing argument that something is large, like in terms of market size, like a huge opportunity, and that it's inevitable. Like it's clear that the world is going in this direction, right? And so I think once you kind of can make those 2 arguments, you've already got the investor on your side of like, okay, I should care about this because it's going to happen and it's a huge market opportunity. And then what's left is just kind of execution risk, which is like the problem solving of how are we actually going to get there if we do believe it, if we're aligned that this is the way that the world's going to look.
And I was actually going to build on that. Sam Lessin had a great tweet recently, which basically said it's some version of like, it's impossible to convince a VC of a thesis. So really what you're doing is somebody who believes in the thesis in general, this is an interesting space. You're telling them, right, it's like they understand the large and the inevitable. And really you're saying, hey, this team is the team that's going to make it inevitable. And here's why. And right, those particularly are the investor conversations that go the best because 1 and 2 are already won. They already believe that, they already knew it. And so it's not so much education and convincing, it's more that you're discovering the right partners in each other.
Inevitability is a really interesting word in this context, right? Because there are certain ways in which like we almost think it's kind of the antithesis to innovation, right? And that it's like, that this is something new, that this is an idea that nobody had. In this specific case and found specific case, what is the inevitability?
Yeah, what is inevitability? I think one, the way that we have treated weight in the past is not working, right? And so the inevitability is when you treat something like a when you treat something like a disease, right? You bring everything to the table. So, depression, for instance, it's not just, hey, you're depressed, you're clinically depressed, meditate and go out in the sunshine. And it's just as ridiculous to say, you struggle with obesity, you've done it all your life. A clinician is very important. So it's personalized to you. It's not just, random dieting advice that I'm sure we've all had from time to time. It is, right? It is the inevitability. It's just clinical solutions to make this efficacious and personalizing all the feedback out there to you. Those are the 2 things that are inevitable. And the one point I wanted to make on that too is it's part of the conversation too, is that it's not inevitable in the sense of if nobody does anything, it's still inevitable. It is that if this team that's going to run through walls doesn't make it happen, then it isn't inevitable. But this team is, right, like with funding or not, like whether it's this particular investor or not, we're going to run through walls to make something happen. And because we so firmly believe in it. So there's a little bit of inevitability for this team making it happen. And I want to be part of that journey.
I have to ask, I alluded to earlier the relatively quick succession with which you raise these two very, very large rounds. Why was it clear that you needed to, or that it was time to raise that second round that quickly? And how much of this at all is really kind of a product of the pandemic?
Yeah, I mean, talking about the pandemic, right? Almost everyone, on average, like gained 30 pounds. So I think the pandemic highlighted a lot of things, but it was already a problem before we went into the pandemic. And so if I had to address of why, right, one, we've seen some incredible sort of fundraising success even in the past year, but I think it speaks to a couple of things. One, that Found's program works. It addresses a very clear gap in access to weight care. And even if you, our program efficacy shows much higher efficacy than if you just took some of those medications on your own, right? Members who receive medication support plus Found are showing at least 23%, better weight loss metrics. So that's really clear. And then I think just in terms of sheer growth and momentum, Found can now be considered the largest weight care clinic. We've had members lose north of 600,000 pounds to date, right? And so
not per person, but
yeah, no.
that would be an impressive weight loss journey.
That would be very impressive. Yes, you would disappear into more than nothingness. Yeah. But I think it's a combination of growth and momentum, but also a program that is highly efficacious.
Yeah, and I would just add on that. I think the momentum is clear, and so I think the investors that we were talking to, and that both Atomic and the Found team were talking to, were just so impressed by how the team kept executing past its goals. So I think, Brian, what you're seeing is kind of a result of that, of investors kind of, renewed and increased bullishness based on the momentum that the company was seeing. I think the second thing to really highlight too is, the most recent round kind of happened, I think, right after we brought on the CEO.
Phenomenal CEO, yes.
Phenomenal CEO. And Sarah, and I've had the pleasure of working with her a little bit, although I always want to collaborate with her more. She's I think that's always a great sign for us when you think about team building, Brian, to your earlier question. That was just a huge vote of confidence, not just how much we loved her, the internal team and Atomic, but how the rest of kind of the market and investor landscape also thought of her as a huge vote of confidence for the company. So I think investors kind of doubling down on momentum and also team is really what we saw there.
So yeah, Jordan, I want to ask you before we move on to the pitches real quickly. I mean, again, obviously in a lot of ways, this almost incubator model that you have at Atomic is different, but in Found specific instance, or really in the instance of any of the companies that you launch, when is it clear that it's time to launch to raise that first external round?
Yeah, I'm laughing because your question, I love your questions, but whenever you're when is it clear? I'm dude, it's always gray. We're always we're always making
when do you make the jump, I guess is a better way to phrase
totally.
it.
I think we internally always believe that we want to have a conviction in ourselves, in the company ourselves, before we bring in on an external investor, right? And so that's kind of the beauty of our model, where we do have capital already, at play, and can also double down and put in more capital if we think there's still things that needs to be de-risked. So the way we think about it is, one, we want to really make sure something has traction and we have strong conviction in it before bringing on an external investor, so that we, that when we're making the convincing argument, we truly believe in it ourselves. And so that means seeing things and I forget the exact numbers for Found, but basically seeing what we think is early signs of product market fit, right? And external investors kind of bring on a bunch of, I think, a bunch of benefits here. One, obviously, we consider all of the partners we work with, co-investors we work with, to be strategic, not just capital partners, right? And so if you think about, Westcap and Google Ventures for Found.
Define, actually.
Sorry?
And Define Ventures.
And Define, that's right. That they've all kind of brought in external expertise, defined around healthcare for sure, and Westcap and Google Ventures around like brand and growth and consumer growth. So, we always think about like when is the right time to bring in that external expertise, be it industry or whatever. Two, I think external investors always bring on like additional legitimacy to the company, and so especially when it's something that's consumer related or even B2B, right? I think that is always helpful for the go-to-market when customers can see an additional legitimacy point. And then lastly, it's just around ultimately around recruiting, hiring, right? And so external investors certainly bring that on. They also bring on their networks where they can introduce key hires into the company and the capital to scale up the team. So we kind of think about both, like, is it the right time on A, do we have enough conviction yet? But also B, is it the right time to like flip on that switch to get the company to continue scaling?
And the one thing I'll add is, I think when you take that on, right, it's as a venture-backed company, there are growth implications. So it's also have sufficient things de-risked so that this capital can actually result in a step change function in growth.
Cool. Well, I will say it is clear to me that it is time to move on to the pitches. Are you ready to see a couple pitches?
Yes, we are. Excited.
Great. Let's do this. So we've got two today. First up is Mai Shimada of Ishma Health. You should see them pop up on screen soon. There we go. Can you hear us?
Yeah. Hey.
Can you hear me okay?
Yes, we can.
We got you. Awesome. Great. Thanks for joining us. You're going to see a countdown clock will pop up and it will count you down to your pitch. 3, 2, 1, go.
Hi, so my name is Mai. I am the co-founder CEO of Isha Health. Isha Health is an online mental health clinic that provides academy-assisted psychotherapy with a licensed therapists and doctors to people suffering from depression, anxiety, and PTSD. So 1 in 5 Americans suffer from mental health problems, and even with the treatment, many don't get better. Therapy is an important part of mental health treatment, but your personal defense mechanism tends to prevent the real issues from being addressed for a long time. And psychedelics like ketamine are a unique way to get directly to your core issues, and sometimes within a day. It stimulates the creation of new brain cells and new connections between neurons, and this makes your mind more flexible to new ideas and new ways of thinking. And I experienced the power of this firsthand. I had some unhealthy mental habits before founding this company. And during the pandemic, I worked as an ear doc full time, and I became a new mom. And after being recommended by my friend, I gave it a try, and it changed the way that I felt, thought, and acted. And I felt really transformed, and that led to the creation of Isha Health. So existing ketamine clinics are mostly brick and mortar, which is time-consuming, expensive, and not very accessible to many. And online providers do exist, but they do not have a comprehensive approach with both therapists and doctors. That's why we created Isha Health. We brought this treatment online with an integrated team of clinicians to make the treatment more accessible to more people by bringing down the cost, minimizing the time commitment, and eliminating the need of driving into the clinic. I am an emergency medicine doctor with over 10 years of experience, and I have worked at multiple ERs and administered ketamine to 100 patients. My co-founder CTO is formerly a founding CTO of Zeals, which is a successful ad tech company based in Japan, and he managed 50 engineers. We launched in California earlier this year, and more than 90% of the customers who entered the treatment with us so far had a positive response to the treatment. We are currently looking for a designer and engineer who want to change the landscape of mental health care with us. So check us out at isha.health, isha.health, and contact me at mai@isha.health. Thank you.
All right. Thanks, Mai. Swathy, for
obvious
health startup launching reasons, I want to start with you.
Yes, I was actually going to first ask a couple questions, if that's okay. Mai, this is really cool. Space makes complete sense. My question to you is, what does it take to have sort of a successful experience with ketamine outside of administering? What do you need to integrate the whole experience? What does a care team look like?
Yeah, so our current team looks like the team of engineers and the psychotherapists and the doctors. So what is lacking in this current industry is that there's really no integrated approach of the ketamine psychotherapy, which requires both the medical doctors who can prescribe medication, do the medical assessment, also the psychotherapists who are trained in the ketamine therapy to be able to provide the full experience of ketamine psychotherapy. So working as a team is very important, and that is lacking. That's why we're creating this online integrated team.
And then one other question of there's a shortage of both doctors and psychotherapists who sort of know this space. How are you thinking about supply and supply?
Yeah, that's a really great question. So like we are definitely in need for more psychotherapy, and especially for a specialized area like this, there is a shortage. Having said that, there's a more and more awareness of the industry that is bringing in more psychotherapists into this particular industry. So we work with the schools that train the psychotherapists specifically specialize in this therapy, so that we can bring in more therapists. And when I posted the ad, we actually got an overwhelming response of the psychotherapists who want to work with us. So yeah, in our particular psychotherapy clinic, we are not really worried about the shortage of therapists.
Nice. I have feedback, but Jordan, if you have any questions, please jump in.
Yeah, I think thank you for sharing. This is super cool what you guys are doing. I think in hearing about your business, my first instinct just jumps straight to how are you thinking about your user or patient acquisition channels? How concentrated you might be to certain channels. How are you thinking about diversifying and testing kind of additional acquisition channels?
Yeah, that's a great question. So we're pretty early stage and we have been trying everything. So our current model is basically self-payment, so direct to consumer sort of. So we have been doing the content marketing, social media marketing, and also the paid search. And half of the customers are coming through the paid advertisement. But the other half, interestingly, have been coming from the referral from the existing healthcare systems, including primary care clinic and psychotherapist agencies. And our clients refer other patients and bringing in more patients. So it's half and half. We are focusing more on bringing clients more from the latter channel, because we realize that they tend to have better understanding of the therapy and they can lead to more lead generation. But mostly it's half and half from through the advertisement and the social media, and the other from the existing healthcare systems.
That's great. And one last question for you is, this is my cursory knowledge. I was under the impression that ketamine prescribing through telemedicine was enabled during COVID, under an emergency, act from the FDA. Do you think there's risk that they will revert that after after the pandemic is over, so to speak? Any regulatory risk there?
Right. So that was the initial concern that we had when we started. But generally speaking, we are headed towards many groups are advocating for the continuation of the current telemedicine rule changes that allow the mental health providers to be able to prescribe the controlled substances on an online basis. So I wouldn't say there's no risk, but it's a lot less risk than we initially anticipated.
Great. So I think we're actually at time right now. So thank you so much.
Thank you, guys.
Good luck.
Great.
Thank you.
Thanks. So we're going to bring on the next person. I was curious, actually, as we do, to get your feedback. A big part of her pitch was this personal story. I'm curious. Swathy, on your end, I know you had the allergy and the weight loss startups. Were these things that you discussed in your own pitches?
Yes, absolutely. Right, because part of the inevitability of team market fit is, why is this the fit? And so I think my particular case, so compelling that she's an ER doctor. She's actually administered it, herself. So absolutely. But I think in the landscape, if I had any feedback, it would be to sort of connect the dots of beyond a couple of states, beyond early stage, beyond that, what might sort of the path look like, because it's clear the market is there. It's clear she has a really compelling background. So right from an investor perspective, they might just quickly move on to, okay, so now we have all of this. How do you go from this to reaching sort of the, sort of the wide swaths of people who need it? So that would be my feedback. I know we ran out of time, but I wanted to articulate that.
That's good. Great. So Derek, I could see you're on. Derek, can you hear us?
Yes.
Awesome. Great. There we go. So we've got Derek Stottlemyre of Find Magic People. Derek, you are going to see a countdown come up real quickly. 3, 2, 1, go.
All right, thank you. I'm Derek Stottlemyre. I'm the owner and architect of FindMagicPeople.com. So there are tens of thousands of independent practitioners in spiritual, psychic, and holistic spaces, ranging from tarot, meditation, sound and energy healing, and much more. And there's currently no easy way to find or access, or there's no directory for these practitioners. So they rely on their own means to reach their audience through search engines, social media, whatever they can do. Find Magic People is a social platform and directory that helps practitioners get in front of the world for a recurring fee. To get a sense of the volume of search traffic, keywords such as Reiki, tarot, spirituality, chakras, each get around 100,000 searches each month, while meditation gets 500,000, and these are all low competition keywords. Find Magic People lists not only practitioners, but also events, both online and in person, and has a wealth of information that the practitioners provide, and it provides a means for people to explore the rabbit hole that these topics provide. There's no direct competitors for us. There are directories for therapists, coaches, as well as a startup called Heal.me. But these focus, and the Heal.me is a subset of our demographic, but these focus on finding the right person to work with, whereas Find Magic People offers a way for people to explore and learn as well as connect. Find Magic People is a bootstrap startup that is live and currently has 50 paying customers in Southeast Michigan. We're clearly viable and seen as valuable, even with our limited traffic so far. However, we're still just local, and we're ready to grow beyond this region. Up till now, we haven't had an advertising budget and no sales team outside of social media. So what we're looking for is capital to scale our successful business operation throughout the U.S. and overseas. I'm the owner, and I have had experience developing international products before, though not specifically in this community-based space.
All right, so we went from ketamine to spiritualism. This is an exciting pitch week for us. Jordan, we had Swathy start last time. You want to start off this time?
I was going to say sign of the times, right? We're all trying to find a greater calling. Derek, so what kind of comes to mind for me is like, I think one, I spend a lot of time kind of digging into what the right business model here. You say like the practitioners pay a recurring fee to be listed. So similar to something like Yelp, in some ways, or is that right?
I see it kind of like a LinkedIn for the spiritual magic realm. So closer to LinkedIn and with aspects of Meetup as well.
Got it. Okay. Yeah, I think in terms of business model, just kind of thinking about, when these are individuals who I don't know what their personal P&L looks like, basically, like what kind of businesses they run. I imagine they're pretty low scale and small. And so a lot of times that can pose to be challenging for if you're trying to do a business model where you're counting on them to pay for your software, right? Or your to get access. So I think that is something that could be challenging. Another kind of aspect of this that came to mind is I think a product like yours can really leverage like long tail SEO to drive traffic, right? And so people and what I mean by that is people kind of searching different types of very specific topics that you guys can create content or help these practitioners kind of create content, even maybe suggest like, hey, it looks like people in your area are like Googling this or searching this, like maybe you should write an article about this and publish it on Find Magic People to kind of help with the user acquisition and to drive traffic.
Yeah, that's a big part of what, I mean, that's where it really makes sense to do this as a community rather than individually, because it's individuals can't do what the search engines are looking for in terms of content and regularity. There's another. I had another point, but I missed it. Yeah, the long tail. So encouraging people to create their own content and really express themselves really both helps the practitioners, helps the searchers, and gives us a long tail keywords. So that's absolutely part of what we're looking for, is to give that freedom for people to express themselves.
Separately, I don't know if this is like okay or not in this age, but I would love to have like a corporate party where we have a psychic there too. Like I have a dream of bringing my team to a psychic offsite just for fun. So I don't know if that's PC or
Sounds
not.
like a very specific request.
That is a very,
but
yeah,
take it offline, Jordan.
But how many businesses are doing mindfulness? How many businesses are doing, thinking outside of the box? I mean, there's a whole spectrum in this realm that can be from sound healing and singing bowls, which, a lot of people are like, okay, that's weird stuff. Oh, but I have a singing bowl, or I've enjoyed Reiki, so, we're providing that whole space from, somebody that's doing this into the really esoteric realms, and people can find what they're interested in. And that's the thing, is like, it's hard to explore on Google because you put in one keyword and you get that. And, where can you really see who's doing what and where? So it's really enjoyable for me to put this together.
Swathy, you have anything in like 30 seconds?
Yes, I was going to say maybe it's more of a question of how would you think about, particularly with expansion beyond a specific state, how would you think about acquisition of these various providers?
Yeah, I think there's clearly interest because a lot of these people are struggling. A lot of them are just, okay, I'm doing everything myself. If something can help them, they're interested. It's, what's the effective pitch, Jordan? What's the effective pitch, Jordan? Your first thing about, these are people that don't like to part with even a small amount of money. So there's a little bit of time, but it's, once people are convinced, they're more than happy to pay, and it takes some time.
Awesome, Derek. Thanks so much.
Thank you.
Congratulations and good luck.
Thank you.
Great. Thanks, everybody. That is TechCrunch Live for this week. Jordan and Swathy, thank you so much for joining us.
Thank you for having us.
All right. Thanks, everybody. We will see you next week.
Bye.
There's always been an innovation economy, and JPMorgan has an entire business dedicated to helping it thrive. By bringing together founders, startups, investors, and ideas, JPMorgan's commercial bank helps empower thousands of high-growth companies that are shaping the present and the future. With tailored banking solutions and a global business network, JPMorgan helps innovators scale for today and tomorrow. Visit jpmorgan.com/startups to find out how they can help you build your future. Products and services of JPMorgan Chase & Company and its affiliates are subject to availability, eligibility, and applicable terms and policies. JPMorgan Chase Bank, N.A., member FDIC.